Hi, good evening. My name is Dawn Holmes, and this is my project for the Community Assessment Project presentation. And the clinic that I chose is the Charlotte Community Health Clinic. This is in Charlotte, North Carolina, and this is for the PM 508 Community Health Scan and Healthcare System from a Community Health Perspective presentation. Basically, in this presentation, along with talking about Charlotte Community Health Clinic, I'm going to start by discussing the description of the clinic. We're going to define the community's mission, the things that they offer. I'm going to go over a data scan, so the health of the community and the demographics of what you would see here in Charlotte, or particularly in this area of Charlotte. Then we're going to discuss the neighborhood scan, so you're going to get more of a description, geographic context of exactly kind of what we're working with and the area. And then I'm going to do a SWOT analysis. I'm going to share some strengths, some observed weaknesses, some opportunities, and then some threats that would be for the clinic. And then we're going to wrap up some proposed recommendations by some things that I did see with the SWOT analysis, so some observations, suggestions, and discuss policies just a little bit. Okay, so let's begin. So it's defined as community, Charlotte Community Healthcare Clinic. This is a private nonprofit organization. Its main mission is really to provide high quality patient-centered healthcare services for low income and then of course some other underserved individuals. What they strive for is really improving the health of the community. They provide the highest quality, as they would say, patient-centered healthcare services to anyone that is seeking any type of care. What their main vision is really having a healthy community where all individuals, regardless of your ability to pay, have access to affordable and quality health care. So that's really important to them. A little bit of background with this is it was founded in 2000 by a group of committed volunteers. The clinic offers primary care, behavioral health services, health and wellness education. There's preventative services, acute and chronic disease management, and then also dental services for pediatric as well as adult patients. So really, they prefer to offer an outreach and an enrollment service to assist people in attaining the Affordable Care Act, attaining those benefits with what goes along with the Affordable Care Act. So with the support of the community partners, the healthcare providers, donors, volunteers, the clinic really bridges the gap between health and wellness in the community. Patients have access to specialty care, diagnostics, laboratory services, screening such as mammograms. They have access to medication and many other services provided to the clinic and the partners throughout the community. So they definitely have some partnerships. Another thing is they offer sliding fees. So to apply for a sliding fee, you just have to fill out an application. You have to prove your household income and your family size, and that will last a year. So every year they would look upon it again. And they need a 1-month pay stub, unemployment check, social security statement, tax return, things like that would really prove your income to be able to utilize this service for free. And that's pretty much it about that. Moving on, the next screen is community characteristics. So there's a lot to be said here. And these are just some of the pictures I took just to kind of give you a visual of exactly what the clinic looks like. So the health center, it receives HHS funding. So these are grants and the Federal Public Health Service. It deems a status with respect to certain kind of health or health-related claims, like medical malpractice claims, and that for individuals. Thousands of Charlotte residents really remain uninsured, so this is a big deal here. The clinic really helps the neighbors who fall through the healthcare gap. And the Charlotte Community Health Clinic, it offers care to uninsured patients on the sliding fee scale, as we mentioned in the previous slide. So additionally, there's specialists on staff and they help the patients enroll for insurance coverage through the Affordable Care Act. Also, the Charlotte Community Health Clinic, it takes positions, and this is important too because it advocates with regard to public policy issues. So the mission is really consistent with the requirements of the applicable federal and state law. However, it does state that Charlotte Community Health Clinic conducts all of its activities in an entirely nonpartisan manner. So Charlotte Community Health Clinic, it acknowledges the elected officials if they support them, but it does not endorse, support, or even oppose candidates for public office. And they definitely don't intervene in any type of election on behalf of the opposition for any candidate or political party. So I thought that that was worth mentioning. And there is no religious representation, public safety. Um, the clinics were both in safe areas. They definitely were clean. They offered nutrition classes for children, adults. So there's lots of educational. And I wasn't too sure. We're going to move on with recreational coming up. So here, the services offered here at Charlotte Community Health Clinic. Basically, their primary focus is preventative primary care. So it's ongoing, chronic disease management. They accept Medicaid, Medicare, basically most major private insurances for those that do have that. The individuals that don't have insurance are definitely able to gain that through the sliding fee scale program. So with primary care, there's medical care, there's laboratory services, there's access to medications for acute or chronic problems, there's radiology services, and definitely follow-up care. So that would go under the primary care. As far as dental, they same thing, preventative, restorative, urgent dental services for the children and adults. Same thing, it's always affordable, high quality care. This is regular teeth cleanings, treatment of the gums, cavity fillings, tooth extractions, crowns, root canals, and also x-rays for your teeth. Moving on with behavioral health, basically their counselors really have experience working with all different types of backgrounds, whether it's mental health, being diagnosed, or substance abuse issues. And, every counseling session they say is different, even though that it might, see a different counselor. The sessions really provide individuals with skills to better take control of their lives, hence different educational practices. During the counseling sessions, they definitely strive to have the opportunity for people or their patients to express their feelings in a safe environment, learn how to think in a better way, such as breaking negative thoughts or habits, how they could communicate better as a person, realizing and finding ways to better manage their life, and of course, most importantly, learning coping skills to deal with life. The behavioral staff too is trained with changes that we see in life, stress, the financial stress, setting healthy goals, anger management, the roles in families, anxiety, depression, trauma, grief and loss, self-esteem, spirituality, and of course, basic nutrition, which again goes to the educational portion. Children's care. So the pediatric clinic, it's only open 4 days a week, and this is open for any child that, from birth all the way to 18. The appointments are available for physicals, immunizations, acute illness, sports physicals, and then weight management. So if you're new and uninsured, and patients with Medicaid are currently being accepted. Okay. Also, chronic disease care. It has 2 chronic disease programs. They have a cardiovascular disease and diabetes care, and patients have to see clinic protocols in order to participate in these specialized programs. So there's some stipulations there. Something that I wasn't too familiar with that I'm kind of learning more about now is the HIV, the PrEP. So through the collaborative effort with the Mecklenburg County, which is what Charlotte resides in, and the Public Health Department, this is a free to high risk uninsured individuals. There's basically a limited number of spots available. This is a pilot program. And then of course, when spots become available, they'll announce it on their website via social media. So they definitely want people to check that. It's a pill that you take every day that can prevent HIV for individuals that are definitely high at risk. They also mention that this reduces the risk of getting HIV from sex by more than 90%, and it reduces the risk by more than 70% among individuals who inject drugs. So those are the people that they're really looking at for high risk. And then last but certainly not least, the health insurance marketplace. Basically, Charlotte Community Health Clinic is really seeking people to get them healthcare coverage. They're definitely committed to doing that. It's showing different ways for private insurance coverage and just fitting the budget and how it meets your needs and kind of understanding coverage, because that can be really confusing. So that's really good that they do that. Now, the next slide is our data scan. So basically, some of the things when looking at University City, because why this is in Charlotte, you'll see a map coming up. It's really considered like the north of the city. And when I say university area, I'm discussing the University in North Carolina or North Carolina, Charlotte. So the total population in this one particular area in Charlotte is 6,868. The total crime there is 6,968. So basically, they mentioned that this is 154% higher than the US average. So basically, your chance of being a victim is 1 in 15. Crime has definitely gone up in the past year. And this is different articles that I looked up, and the Bureau, Area Vibes, Mecklenburg Government Health Department, just different areas that I'm kind of getting these statistics from as well. So with the race and ethnicity distribution, this particular area is 47% white, 31% black, 13% Hispanic, 6% Asian, and then 3% two or more races. 13% of the adults report having mental illness. 32% of the high school age students, I found they reported feeling sad, hopeless, or even suicidal. The homicide rates really increased for 8 African Americans to 1 white. And then in 2017, the latest results that I could find in this area for this, it said the leading cause of death was cancer, then it was heart disease or unintentional injury, stroke, and then Alzheimer's. So another thing that really spiked is the drugs. That's been a huge issue since the 5 years that I've lived in Charlotte. Drugs has been increasing every year. The heroin deaths, they've seen a spike. They've definitely grown at least 9 times from 2010 to 2015. And in 2017, it said in this area, 654 visits to the emergency department alone just due to opioid use. 41% of fatal car crashes in this area were alcohol related, and 30% is higher than the average across the state in North Carolina. Mecklenburg County, which includes Charlotte and the University North area here, it saw 121 deaths from opioids and overdose in 2016. Okay. Now, as far as going over the neighborhood, I drove to the first, which was the main center, the University North one. That's their main clinic. And then I drove to the other area, which is about 18 minutes away, and that was closer to the Charlotte airport. So the clinic, I'll get in some other information and then kind of click here. So the clinic is more up in this area, okay? And the airport, the other one, there's a clinic over here as well. These are all the clinics that are in the city. So it actually kind of has its own areas per se that are kind of untapped resources. And with this, it says the clinic values the diversity reflected in their community. They have patients that speak 31 different languages. They come from 69 different countries. So basically, they like to have their staff very diverse and striving to provide each patient in an appropriate cultural way. So while driving around and kind of scanning the neighborhood and researching on satellite and seeing different things that I didn't necessarily see while I was driving around, I definitely observed numerous, really to many apartments. There was really only apartment buildings around this area. There was a Harris Teeter, which is considered more of an upscale grocery store here, and then Food Lion, which is more like lower income grocery store. There's also like a Longhorn Steakhouse restaurant. There was a YMCA. There were several employment agencies. There were several banks, and then also an animal hospital and 2 daycare centers. So Charlotte alone has a population of, it said 808,000. It's been the 17th largest city in the United States. The median age is 34, and 48% of the population is considered married if they're over 15. 79% speak English, and 12% speak Spanish. And 42% of the Charlotte residents were born in North Carolina, while 41 were born out of the state, and then 16% were foreign born. Okay, so again, this is all really important of how diverse this area is. So the population growth, as you can see here, I got this from the census. In 2017 to 2018 alone, 43,350 people moved to Charlotte, and it said that averaged out to about 853 people a week, or if you can imagine, 122 people each day. So Charlotte is growing leaps and bounds when I tell you there's construction on every corner, every major highway, side street, it's everywhere. And it's been like that since I moved down here in 2013. So when we look at the zip code that the major clinic is in, the 28262, comparing it to the state average, it says the Black race population percentage above this is above the state average, and the median age significantly below state average. Okay. Also, the white population, it has here for this area is 13,834, while the Black population was 14,587. The American Indian population, 147. Asian population, 4,566. Native Hawaiian or other Pacific Islander in this Pacific University area is 13. Some other race population is 132. If you are two or more races population, biracial, 939, and Hispanic or considered Latino population would be 3,329. And also, households receiving food stamps in the university area is 1,170. Okay, and here the SWOT analysis. So I'll go ahead and go over some of this, and then I'm going to share some more information. So basically, some of the weaknesses, I reached out to the clinic numerous times to gain some interviews and find some public policy. Just had some questions and different things I could find or what I couldn't find. And there was really a lack of communication with the clinic employees. And I would say that's probably a lack of initiative with leadership there. Also, when I tried to really dig deeper, I looked up different reviews too to kind of see what people felt and thought about this place. And there was a lot of negative reviews from patients that didn't really feel like they got the treatment they deserved, or like me, they couldn't get a hold of anybody. So that was something really important. If you're trying to get a hold of someone and talk to someone and you can't, I would definitely say it's a weakness. As far as opportunities, grants, since this is extremely important for them to stay open, grants would be important. Partnerships with local companies. When I saw the YMCA, for sure, I felt like a gym, family, membership, individual membership. This would be great to contributing to preventative health like they want. Or like even nutrition classes and doing things there. I thought that would be great. As far as threats here, I wouldn't say any structural factors. They were pretty new. I mean, it said 2000 when they opened, so 20 years sounds like it's slightly old, but actually they looked really nice and new, unless that's not the original building that they were in. So go here. So my last slide, just kind of wrapping up the proposed recommendations. There were two separate locations, and you could see some of the pictures in the first slide. One location's by the airport, which was the dental, and when I went there, it only said dental. It didn't offer anything else. So I thought that that was kind of inconvenient because when I had to turn on my GPS and go to the other location, it was 18 minutes away. So for somebody that doesn't have a car and really relies on public transportation, I feel like that's just inconvenient. So it kind of needs to join forces. And maybe there just wasn't enough room in the first building, so they had to go somewhere else. And the closest place was, 15 to 18 minutes away, depending on your traffic. Um, if people are unable to answer the phone, get back to people, or give good customer service, a lot of times because people are burnt out. So I would suggest that additional staff, but with additional staff to create things like flexible hours with the proposed recommendations, you definitely need more money. So there's probably just not money in the budget to do those things at this point. But I do think, 4 days for pediatrics or, hours until 4, it doesn't seem that convenient because if somebody's working during the day, if most people work like 8 to 5, 9 to 5, 9 to 6, and the traffic around here with all the construction, people might not be able to get to where they need to be. Maybe some hours on the weekend, for those that have off on the weekend, or maybe one night a week you are open later for those that do work during the day and can't miss work to go to the doctors. And as I suggested before, partnerships with nearby businesses. There was plenty of banks. There was job centers, resources, and then the YMCA would be great for their focus of preventative health. I really enjoyed this presentation. I really enjoyed this project. Just being able to learn about the resources that we have here in Charlotte. And I hope you enjoyed the presentation. Thank you.